Hi, hello everyone. Welcome to another beautiful day. If you are just joining me for the first time, you're very welcome. Do well to subscribe to my channel. And if this is not your first time, but you haven't subscribed yet, kindly subscribe to Nurse Ayodele. My name is Nurse Ayodele, and my post I talk about medical conditions in the simplest way possible for you to understand, and so that you are able to share the knowledge to your friends, family, and everyone around you. So do well to subscribe to my channel, watch my previous videos. I've got loads of videos for you to watch and understand from. Do well to engage with the post, share it, like it, comment, and let me know how I am doing with the videos. Thank you very much for that. All right, let's come back to today. Today we'll be talking about hypoglycemia and also the first aid treatment in hypoglycemia. Low blood sugar, that is what hypoglycemia is. Low blood sugar is it can come suddenly. It can come suddenly, and if not treated fast, it can become life-threatening. It can become life-threatening, and this is especially common with people with diabetes who uses insulin. It is very common with people who uses insulin or on certain medications. So today let's simplify hypoglycemia, what it is, and also the first aid treatment in hypoglycemia. Follow me and don't get distracted. Okay, let's go. All right, what is hypoglycemia? Hypoglycemia means low blood sugar that has dropped, a low blood sugar level that has dropped too low. It has dropped too low. Glucose is the main fuel that we use in the body, especially for the brain. So without enough sugar, there will not be enough glucose for the brain. Take note of that. There will not be enough glucose for the brain. All right, let's go. Without sugar, the body, the brain cannot function properly. The body and the brain cannot function properly. What are the common causes of hypoglycemia? We have skipping meals after taking insulin. You need to have your meal beside you before taking your insulin. You need to have your food beside you before you take your insulin. If not, you will come down with hypoglycemia incident. Taking too much insulin or tablet. If you're on insulin, take the right dose. If you're on medication, take the right dose. Another thing that can cause hypoglycemia is excessive exercise without eating enough. If you want to exercise, make sure you've eaten enough. Make sure you've eaten before. Some people, you didn't eat last night, then you go to start exercising in the morning, then you end up with hypoglycemia. Another thing that can cause it is drinking alcohol without food. Drinking alcohol without food can lead to hypoglycemia. Also, illness or infection that affects the blood sugar control. Illness, or if you've got infection of the pancreas, something that is affecting your sugar control, you can end up with hypoglycemia. So these are the causes of hypoglycemia. So what are the signs? What are the things that you will see that will make you realize that, oh, this is hypoglycemia? You are going through hypoglycemia, or you've got somebody going through hypoglycemia. So these are the symptoms. The first thing is shakiness, sweating, and fast heartbeat. You will just see that all of a sudden that person is sweating, that person is shaky, and the heartbeat is very fast. That is a sign of hypoglycemia. Another one is hunger and dizziness. You just see that that person cannot keep the eye still, that person is dizzy, and all of that. So another one is confusion, irritability, or even headache. Confusion, irritability, and headache. All of this can lead to hypoglycemia. Another thing that can lead, another sign is blurred vision. when you see someone with a blurred vision, know that that person is probably tending towards hypoglycemia. Another thing in severe cases is seizure, loss of consciousness, or even coma. That's how bad it can go. It can lead to coma. So you see why you need to pay attention to yourself. Yeah. All right. So if you see someone that has gone into hypoglycemia, what are the first aid treatments that you can do? The first one is check the blood sugar if possible. Check the person's blood sugar if possible. Give 15 grams of fast-acting sugar. That can be done in the hospital. Give 15 grams of fast-acting sugar. If it's not in the hospital, give 4 ounces of orange juice, like 4 glasses of orange juice. Give 4 glasses of orange juice. Give 1 tablespoonful of sugar or honey. Give 1 tablespoonful of sugar. Then another thing you can do is give cake, biscuits, oranges. Let them have something as long as they are conscious. As long as they are conscious. Another thing, wait for 15 minutes and recheck the blood sugar again. Wait for 15 minutes and recheck the blood sugar again. Another thing is, if the blood sugar is still low, repeat that process again. Give orange juice, give honey, give sugar, give cake, give everything possible. Everything that is possible, you give this person. So once that person is stable, then you can give a meal that contains carbohydrates and protein, just to keep that sugar level steady. Give them proper meal that contains loads of carbohydrates and protein to keep the blood sugar steady. Those are the first aid treatments that you can do when you have someone that has come down with hypoglycemia. So what are the things that you should not do? What are the things that you should not do? The first one is, if the person is unconscious, don't give food. Don't give any drink. Don't give any food. Another thing is, don't delay the treatment. Immediately you see signs, either you give that person a drink immediately, take that person to the hospital immediately. Do not delay treatment. Do something immediately. Immediately act and take action. Another thing you should not do is, don't overfeed. Don't overfeed, because too much sugar can spike sugar dangerously high. When you give too much sugar, it can spike the blood sugar and it will be dangerously high. So you need to know what you are doing. Don't overfeed, okay? All right. So you call emergency. If the person is unconscious or the person is having a seizure, you call emergency immediately. You call the hospital immediately. If you don't have any fast sugar available, call the hospital and take that person to the hospital straight away. If the symptoms does not improve, go straight to the hospital immediately. Go straight to the hospital immediately. Another thing is, if you don't know what is happening, probably you check the blood sugar and the blood sugar is normal, so probably that is not hypoglycemia, but that person has passed out. Take that person, call the hospital immediately. Don't wait. Don't wait. Call the hospital immediately. In some cases, people need glucagon injection, so they need to get to the hospital immediately. So that is it for hypoglycemia. Hypoglycemia happens very fast. It happens very, very fast. So you can reverse it safely if you act fast as well. You can reverse it safely if you act fast. So that is it for hypoglycemia. So my challenge to you today is, if you know someone with diabetes, learn the signs of hypoglycemia and also how to check blood sugars, so that you can save that person's life when they need to be saved. So that is it about hypoglycemia. Thank you for joining. If you haven't subscribed, kindly subscribe, share this video, like this video and comment. Thank you.